Hello everyone, this is now Tuesday, July the 8th. This is day 11 after my surgery. Everything is going well. The shoulder is healing fantastic. I went to the doctor yesterday and had a meeting with him 10 days after, at which time they took the stitches out, which I can actually show you guys the incisions. They threw the little pieces of tape over it here, but there's really not much to see. There really isn't. It's just tiny little incisions in the front and then a couple in the back there. They're really not bad at all. I have never had stitches before, so I was nervous about the stitches coming out, but it was very painless. It was fantastic. I also went in with a picture that I asked him to draw on and show me exactly what was wrong, and I went in with a laundry list of questions. We'll start with the questions that I had for him. Basically, I asked how bad the damage was. What was the deal? Because I know what we had talked, or I had told you before about how bad, I was told it was through my wife, who had been told by the doctor. And basically I had him draw on this, and I'll do another narrated video which kind of shows it in more detail, but I'll try to do the best I can for you here. Basically, you can see this is a cutaway version of the shoulder, and he has 7 anchors in here, as opposed to just a normal 3. If this is the anterior or the front of the shoulder, normally it would be torn between 3 o'clock and 6 o'clock, but mine was torn between 3 o'clock and 1 o'clock. So he had to actually put far more anchors than he thought he was going to have to. Again, I said the record was 8 and I got 7, so I didn't win, but it's not something I really want to win. What would cause that much damage? He just said simply put the number of times I dislocated it. I personally think it had more to do with the hospital trying to and failing many times to put it back in this most recent time. But whatever, it's neither here nor there, it's fixed now. I asked if I was predisposed to the dislocations, meaning is my right one going to come out? Is my cartilage already damaged? Do I have bad joints, basically? And he said no. He said when it happens once, it's going to happen again because it's such a traumatic injury, which I knew going in, but I still thought it pertinent to ask. I asked if there were any supplements I could take, vitamins or minerals, and him being a doctor of medicine, Western medicine, he immediately shook his head. Now, I don't know if that was bias on his part or if that was simply, he said, no, absolutely, there's nothing you can really do, or maybe he just doesn't know. I don't know. But I believe that he believed the answer was absolutely no. That being said, I still plan on taking my own, cocktail of vitamins and minerals, a lot of B vitamins, a lot of calcium, stuff like that, just to try to help with things. I asked, when do I start therapy? He said, basically, really any time. He said 3 weeks out is your best time. So I'll probably be another week and a half before I start. He said, I'm in this sling here for 6 weeks. Wasn't looking forward to that. That means I have another 4.5 weeks to go. By that point, I don't know. I'm just going to be so tired of it. I'm sure this thing will be covered in dog hair, even more than it already is at that point. Maybe it'll be white by the end. I don't know. We'll see. At that point, the cartilage will have healed, but it still needs time to mature. So the 6 weeks after taking the sling off, it's a matter of still no weight, but letting the newly formed cartilage to heal, give that time to heal. When do the stitches come out? Obviously, they came out yesterday. When can I get the incisions wet? Like I said, never having had stitches, I didn't know anything about them. I didn't know what I could get wet, what I couldn't, when I could start actually showering and not have to worry about just, washing around the area. And he said, now that the stitches are out, you can go ahead and get it as wet as you want. What will it take to damage the repairs? Remember I told you in the video, I think it was day 3, that I had had a dream and I felt a twinge in the shoulder because I was moving my arm. And he said that in the sling, it would be very, very unlikely for me to damage what he had repaired. He said it's not impossible because nothing's impossible, but it's very highly unlikely that you could do anything while wearing the sling that would cause you to tear or basically damage what I just fixed. He said moving forward, when you get the sling off, make sure the weight restriction, you adhere to that, because that is really the crucial time where the cartilage is really maturing and really coming to be. So make sure you follow that to the T. And then a couple questions I had, with all the anchors that he put in, and I've had surgery on my knee, I was hoping for like an x-ray where I could see all the nice metal screws in there and I could kind of look like the Bionic Man. I could, you know, maybe pin it up on the wall or something. But he said the x-ray isn't going to show anything because the anchors themselves are the same density as the bone. And on top of that, they will biodegrade after a couple years. So I was kind of bummed that I won't be able to be the Bionic Man and show myself off, you know, via x-ray. I did also want to share with you quickly some photos, and again, I'll do a narrated version of this, but basically, these are the before photos. And if you look at the one here in the top right, you can actually see where the cartilage has separated from the bone. You've got the cartilage here, the bone there, and that little pink area in the middle is where it has started to separate. And it's the exact same thing over here on this one. Same situation, bone, cartilage, and he's actually sticking an instrument down in between the two. He said he shouldn't be able to do that. But a great shot of the repair is right there, and you can see the sutures and everything that had screwed it all back together. So these two here are basically the same view, just that was torn and that one's fixed. And you can see the sutures in some of the other pictures here as well. But again, I'll do a narrated video on that. I just wanted to share those quickly with you. So all in all, it feels great. The only pain that I have, again, is when I move it. And unfortunately, I'm a violent sneezer. I don't know anybody that isn't a violent sneezer, but every time I sneeze, which has been quite a few times these last couple days, it just feels like somebody's ripping the arm completely out of socket. It hurts so much to sneeze. It's to the point now where I support it underneath and try to just hold it as best I can with my other hand, just to keep it from moving. We'll see how well that works out for me, but that's the only time it really hurts. Right now, just standing around, talking, doing anything, normal motions, it's perfectly fine. When I sleep, I still have to sleep either on my back or on my right side. And when I sleep on my right side, the arm hangs forward and it hurts a little bit when I hang it forward. So unfortunately, I still have to sleep on my back, which is tough for me because I'm a stomach sleeper. But all in all, great day today, great last couple days. The weekend was fine. You'll be fine if you're going through the surgery. The couple days, the first day after sucks, but after that, it only gets better from there. When I start therapy, I'll definitely keep you guys posted, but I'll try to do a video a week, maybe one on a Monday, maybe even one on a Friday, and just to keep you guys updated on my progress. So thank you very much for watching, and I will keep you updated.